Alright, hi everyone, my name is Mari. Today I'll be showing you guys how to use the Alaris pump. So just before we get started and turning this on, I want to show you a few things. So this is our main computer and this is our channels. As you can see over here, there are little bars and this is where you can attach more channels. So I've seen people do like 2 on each side. So if you want to release this channel, you just have to press this blue button down here and then lift up and out. And there is the bar, and this is the connector. To put it back on, you just have to place it on top and then push down, and it should click. Now that we have our channel connected, we can go ahead and turn on our program pump. So over here is a system on button, and you only have to click it. The pump is on, you will see that it will give you a prompt that says new patient. If you click yes, then it will clear the previous patient data. So if this is a patient that you've already been working with and you're continuously putting your scheduled IV fluids, you can press no. But if it is a new patient, please select yes. If it's an adult, please select yes. Okay. So now we are at our main page and it will say select channel, and this is how we're going to be programming our stuff. So to program, we press on channel select. And now we have 3 messages. So we have guardrail drugs, guardrails IV fluids, and no guardrails. Example that your doctor has ordered you to administer Tylenol, potassium, or even a secondary fluid such as an antibiotic. We would go into the guardrail drugs, and this is where you would find all your medications. Going back, you could press exit below and again channel select. Again, your first one, guardrail drugs, is for administering medications and secondary fluids such as antibiotics. Your second one is for your IV fluid, such as a fluid bolus. And last but not least, you have your no guardrails. We never use this one, or we try not to use this one, because as you can see, when I press no guardrails, there's no safety features. It would only go straight to your rate and volume to be infused, and it does not know what exactly you are administering. Okay, so to use the Alaris pump, you're going to need these 2 things. First, we have the Alaris pump infusion set, and you have your secondary set, and these are both tubings you'll be using today. Alright, so now I'm going to go ahead and teach you how to prime a bag. I always do hand sanitizer, hand hygiene, and put on gloves before I do anything. So before I get started on anything, I want to show you guys how to remove these tabs, which you're going to be spiking in later. So this one, it looks like little wings. These are twist offs. You would twist the top one. For these ones, you see a blue cap. For these ones, you just pull off. So again, blue pull off, wings twist off. I want to make sure that you understand a little bit about the tubing. So here we have our spike and our chamber. Make sure that this spike stays clean and aseptic. We want to make sure that nothing touches this before we spike. Then this is our chamber. We have our tubing. And then this is what is going to go into the pump. There's a little cover, and I'm going to take it off later. And then we go down, and there's actually a clamp. A good key note is to always clamp your tubing shut prior to spiking the bag, or else fluid will get everywhere. So always clamp it shut. This is your clamp. This is open, so the thicker side is open, and then you're just gonna slide it on to the right. And now it is closed. Other end, and this is what goes to the patient. This is another portion that needs to stay aseptic. So make sure that this is clean and you do not touch it. All right, so let's get to spiking. So I have a trash can below me, so I'll be discarding things as we go. So first, again, we have the wing, so we're gonna twist off. And it comes off, and that goes in the trash. And make sure this also stays clean, because remember, we're spiking this bag. The next thing I'm gonna do is take off the cap, making sure not to touch the tip. And now, the best way to put this in is to spike it and then twist. So I'm gonna go ahead and spike it and twist. All right, the next thing we're gonna do now that we have it spiked is we're gonna give this chamber 2 squeezes to make sure the fluid goes through. So as you can see, we are getting some fluid, which is great. The next thing we're gonna do is unclamp this to let all the fluid go through the tubing. Now it's important that we make sure that at these sections that we keep them raised as we are letting the fluid flow, because bubbles can actually form at these points. So I'm gonna go ahead and do that now. And when you're unclamping, we don't wanna unclamp it all the way, we wanna slowly unclamp it. So once we get to near the top part, I'm actually going to be near a trash can to let the excess fluid go through. Alrighty. Alright, the final step before we connect to the patient is to double check our line. We want to make sure that everything is clear and we do not have any bubbles or anything like that. We also want to make sure that our fluid is clear and not cloudy. Alrighty, now that we have our line primed, we're going to go ahead and go back to the pump. The first thing I like to do is to make sure that we connect our line to our pump. So to open this up, there's a little leverage tab and you're going to pull it up and the door should open for you. So when we get this line, we always have this blue sheath on it. We could just take that off. It's just a protective covering, and this would go in the trash. Alrighty. So the next thing I'm gonna do is there's 2 parts. There's a key portion, and then there's this little tab on top. This tab goes on top, and this key goes on bottom. Okay, so this goes on top. You can't go in through the side, so go in on top. And then you're gonna stretch. This is stretchy, so you're gonna stretch and put this in the key port at the bottom, and it should click. And then, last but not least, we wanna make sure that this line below is clamped in right here. So it should be one straight fluid motion here. To close it, we're just gonna go ahead and reverse what we did earlier. So close the door, and then pull this leverage down and you should hear a click, like that. All right, now that we are connected to the patient, our line is connected to the pump, we can go ahead and start programming. So again, we're gonna turn the system on. There's the power button right here. We do not have to hold it down, we just click on it and it should turn on. So let's say our doctor has ordered for a 125 milliliter per hour for a liter bag. We're gonna go ahead, and this is a new patient, so I'm gonna go ahead and press yes. And they are an adult, so I'm also going to press yes. And the next thing I'm gonna do, press channel select, because this is the pump we want going with the sodium chloride. So we're gonna go ahead and press on guardrail IV fluids. And this is just an IVF maintenance, so we're gonna go and click that. This is where we would double check my order, and I would be like, yes, I am doing an IV maintenance, so I'm going to press yes. So now we are at the rate and the volume to be infused. So like our doctor's order said, and I'm going to double check, it says 125 milliliters an hour. So I'm gonna go ahead and press on rate, and I'm gonna put 125, so 125 milliliters an hour. The next thing we're gonna do is the volume to be infused. Now this is important because we have a liter bag or 1,000 milliliter bag. However, I don't want my program pump to tell me to come back once it reaches 1,000 milliliters. So what I'm gonna actually do is program it for 950 milliliters. Why? That way my bag is not sucked dry, and also we have a little warning so I can come back and make sure that everything's going well. So once we have all of that set, we actually are going to double check our orders one more time to make sure it's 125 milliliters an hour. It is a sodium chloride bag, and that the volume to be infused is 1,000 milliliters, and in this case for me, it's going to be 950 now. Once we are all set and we are good, we are going to unclamp our patient, and then we're going to press start. So I've gone ahead and paused our pump for now, but I wanted to mention something super important, which is when you're coming onto the floor, for example, and you're getting a new patient and you want to check what fluids they're on, what the rate is, this is where you can go ahead and see those information. So right here we have the rate at milliliters an hour, so 125, and below it should say what we are putting in, so IV fluid maintenance. And as you could tell, it's paused, so it'll also tell you pause. This screen below will often tell you anything when it comes to the line, so if there's an occlusion or anything like that, it'll mention it here in alarm as well.